Hello and welcome to Live Healthy West Virginia, a podcast brought to you by WVU Medicine, aiming to help everyone live a better, healthier life in West Virginia and beyond. I'm your host, Mary Ravazio Menard. September is National Pain Awareness Month. And if you are one of the 100 million Americans suffering with chronic pain, you're already more than aware of it. So today, we're talking about what you can do about chronic pain. What causes chronic pain? What are the best ways to treat it? Do you just have to learn to live with it? We'll answer those questions and more with Dr. Richard Vaglienti, Director of the WVU Medicine Center for Integrative Pain Management. Welcome, Dr. Vaglienti, to Live Healthy West Virginia.
Thanks, Mary. Good to be back.
Good to have you here again. Okay, first of all, September is National Pain Awareness Month. So it seems like the mission of this awareness month is not only awareness, but increasing understanding of pain.
In a way, yes. And really to understand that there are so many things being developed so rapidly in the field of pain medicine and pain management that you don't really need to worry about if anything can be done for you. Eventually, something's going to be developed that will help individuals with their pain problem. Our center is a little different because we deal in a multidisciplinary fashion. So we have multiple specialties under one roof. But I'm impressed, even though I've been practicing quite a while, how rapidly things are developing. It's very, very encouraging and exciting.
A lot of hope, a lot of options.
Oh, absolutely. More and more every day.
That's great. That's great. So whether you suffer from back pain or migraine or neuropathy, I think people need to know they're not alone, right?
Right.
So what exactly is considered chronic pain? What's the formal definition?
Well, that definition is pain that extends beyond normal healing, which is usually considered to be 12 weeks or 3 months. So if you have an injury and you're still having pain, or you've had a back operation and you're still having pain at 3 months, that's considered chronic pain, and that's a majority of what we do.
Okay, so that's the majority of your patients. So what are the most common causes of chronic pain?
Well, certainly number one is back and neck pain. 85% of individuals will have back pain at some point. Most of those incidents resolve on their own in a short period of time, but others don't. And so there are just almost innumerable amounts of individuals who have chronic back pain or neck pain that we deal with every day. And that's sort of the number one reason that people come to see us. But arthritis pain and some muscle tension headaches and neck-related headaches we deal with too. And cancer pain, of course. Almost any kind of pain you could have, we've dealt with and do deal with on a daily basis.
So I know we were talking, I asked this about at the top of the show, but the big message here is you don't have to just live with the pain, right?
Absolutely, yeah. And the worst that would happen is if you ask us, can anything be done? And we say, no, not at this time, you're no worse off. But certainly if you sit there at home and worry or suffer and don't ask us, then you may never know that there is something out there to help you.
Yeah, I always say, if you don't ask, the answer is definitely no, right?
Right.
So I think sometimes people are afraid to come forward because there's a stigma attached to chronic pain and oh, you just need to move more, or you need a higher tolerance. Talk a little bit about how the stigma that's sometimes attached to this can hinder people.
Well, you hit on a good point there. And so the model that we live by now is called biopsychosocial. And so we don't just treat the body, we treat the mind and how you interact with people at work or at home or where you go to have recreational activities. Because all those affect how your pain is interpreted by you and by others. And so it really shouldn't matter what other people think. If you're in pain, and particularly If your pain impedes you from doing things you like to do, like now at this particular time of the year, it's gardening. I hear that a lot. You know, I go out and work in the flower beds, and then I have to pay for it for 3 days. Well, you know, you may not have to pay for it for 3 days, but we would rather you do that and have some enjoyment than rather to sit there and try to avoid movement or activity. But again, the number of things available are just multiplying very rapidly.
Okay, well, before we talk about those options, I did want to talk about how, you know, when the opioid epidemic really took off, there were these pain clinics that were just popping up all over the place. Can you talk a little bit about what it means to be a board certified pain doctor and why that's important? Because I know you're one, right?
I am. Well, you hit on two important areas there. First of all, the name pain clinic for a long time became synonymous with opioid medication. And so that's unfair. I've always felt upset about that we get lumped into one bucket with all those individuals who are profiteering off people's addiction or substance use problems. So that's number one. But number two is there is a board certification in pain medicine, which is through the American College of Graduate Medical Education. That is the board that sanctions all other boards. So you have to be careful as a patient, because I'm board certified in anesthesiology, but I'm also board certified in pain medicine. And I'm really astonished at how many people try to pass themselves off nowadays as pain doctors and they'll tell you I'm board certified, and they may be board certified in a primary specialty, but they're not board certified in pain medicine. And so that requires extra training and extra skills that have to be learned that you don't learn in an apprenticeship or going to work somewhere for a year with somebody. It's just not the same. We have a very, very broad and deep curriculum that we have to follow for our fellows. And I also think it's important for the people here to know that we do have a pain fellowship here at our clinic. It's the only one in West Virginia, and it was part of our mission to take care of the people of West Virginia, to increase the number of pain physicians, because physicians are short everywhere in all specialties.
Oh, wow. So if you're looking for a provider for chronic pain, you should find out exactly what they are board certified in, because just being board certified in anything other than, it's not all pain management, you know, right?
Right. Yeah. No, you're right. And that is important. So, you know, it's a separate board. There's certification in pain, and there's certification in all other specialties.
Okay. So opioids are not the only way to treat pain. Let's talk about what are some of the other options out there that don't involve pain medications.
Well, again, going back to that biopsychosocial model, it may be, when it relates to the body, it may be physical therapy or chiropractic manipulation or injection therapy or medical management of all types of medications, not just opioids, but antidepressants, anticonvulsants, a whole host of medication. And then there may be times when counseling, or what we call cognitive behavioral therapy, is needed, which helps you learn how to live with your pain and helps you learn how to cope with your pain. And then, of course, social has to do with how you interact with your world. And so that depends. If it's a work-related injury, then we're obviously going to try to get you back to work.
Right.
If you want to do something that is particularly important for you, like go to church or go to meetings and things like that, we want you to try to do that, and we want to try to get you back to that level.
That's great. We were talking about this before we started recording, about how pain management, I mean, it's really evolved over just the last few years even. I mean, there's just always something new. What are the most common treatments that you're using right now to help your patients?
Well, certainly injections are a large basis of what we do, but there are numerous now minimally invasive spine procedures that we do that can help individuals. For example, we do a certain procedure, and I don't do all of these, so I want to make sure everyone understands that. We all sort of have our own little niche, and in fact, I like for each of my doctors to have a procedure or two that's minimally invasive that they're really good at, that we can offer to people that come to the clinic. So that being said, we do something that's called basivertebral nerve ablation, which is in particularly older people who have spinal pain and are not surgical candidates. One of our doctors can go into the vertebrae itself and cause the nerves of the vertebrae to be permanently anesthetized by heating them up for a period of time.
Wow.
And so that's very effective. Now, let me say, as we get into this topic of minimally invasive, if you need spine surgery, you should by all means get spine surgery, okay?
Right.
Anytime you can intervene surgically in a problem, when there is a surgery for that problem, you should do that, because that's the most effective and cost-effective things, absolutely proven. But if you try that and you have persistent pain, then we can help with numerous things. And so my area is kind of implantable pain devices. So spinal cord stimulators and pump implantation. We have others who are getting involved in sacroiliac joint fusions. We're not into that yet. We're doing a lot of peripheral nerve stimulation. One of our physicians who trained at Stanford brought that program here with us. And so I'm constantly evaluating new procedures and new programs that our clinic can bring to help the people of West Virginia and keep them up to date nationally with what everyone else is getting.
Well, you talked a little bit about the spinal treatments. When you're talking about spinal cord stimulation, explain what that is and how it works.
Sure. It's been known in a simplistic form as a pacemaker for pain. And so it was derived from pacemaker technology way back in the early 70s. And so it's an implantation of a wire connected to a battery that stimulates the spinal cord to block pain signals to the brain. And it's extremely effective in certain cases. There's an evaluation process a patient has to go through. And of course, we've talked about this in the past. One of the most popular reasons or indications is diabetic peripheral neuropathy. And that program has just blown up and been going great guns. I evaluate, when I'm in clinic, 2 or 3 or more patients a day who are interested in looking at spinal cord stimulation for diabetic neuropathy. The results we've had have held up. They're the same as what the original research showed. Patients get 70% pain relief or more. And of those patients, about half of them get some or all their sensation back in their feet.
Wow.
Which is, it's amazing.
That's life. That's really life-changing, isn't it?
Absolutely.
Wow. Well, that's good to hear. And you said there's new stuff every day.
That's right.
What do you see on the horizon? What can we look forward to?
Oh, it's hard to say. I think this minimally invasive area is going to get bigger and bigger with different techniques for different problems. For example, one of the things that we've partnered with the Department of Anesthesiology is this procedure that the regional anesthesiologists do in our clinic to pre-treat your knee before surgery. So they use a handheld device and they will freeze the nerves around the knee to make your knee numb so that the surgery goes much better. You use many fewer pain medications. It makes the rehabilitation process go much better. And so, some of our surgeons have bought into this, and their patients in most cases are extremely happy.
I would have loved to have tried that 5 years ago when I had my knees done.
Maybe if you need a revision.
Well, I hope I don't. I hope I don't. But that's something to look forward to, definitely. We did talk about how this all helps with diabetic pain as well. What are some other good resources for those that are struggling with chronic pain?
Well, as I get older, I find out that strength and flexibility are really the fountain of youth.
Yeah.
And so there are any number of ways to do that. And yoga is a great way to do it. Tai Chi is a great way to do it. Pilates also. There are numerous things on the internet, programs you can do in your house that will help you gain strength and flexibility, which is very, very important as you age.
Yeah.
I know my balance is not what it used to be.
Mm-hmm.
And so, that's one of the things that leads to a lot of other injuries is falls. So anything that you can do on your own that improves flexibility and strength,
And balance.
yes, and balance, that's not harmful, doesn't hurt you. And I don't mean like muscle aches. I mean like harm you, like injure yourself. You should try that, even a little bit.
Okay, that's good to know too. Well, now I want to talk a little bit more about the depth of experience at the WVU Medicine Center for Integrative Pain Management. I mean, you've got a pretty deep bench over there, don't you?
Yeah, we're very fortunate.
And it's that, you mentioned it a little bit, but it's that whole body and mind approach, correct?
Right. Yep, absolutely.
So what can somebody expect if they're being treated at the center?
Well, when you first come in, you're going to be seen by a physician, and you're going to be evaluated, and a treatment plan will be outlined for you. And then, if there are things that we have on site, which are numerous, for example, dietitian or exercise physiologist, chiropractic, counseling, lots of things like that. And everyone works in combination with everyone else. So, that your plan may have some of those things or all of those things in it. And then, we work very hard to make sure that it's convenient for the patient. So if you're traveling a long way, and many of our patients travel hours to get to us, we try to coordinate so that you can have multiple visits in our building in one day. So there's that. And then we have a whole group, a whole team of advanced practice providers who are top notch, who then will follow you and implement that treatment plan and continually evaluate your progress. And as we have talked a lot today, as something new comes along, they'll come to us and say, hey, would this new thing work for so-and-so? And we may say yes or no. And then off you go on another branch of your treatment plan.
And that's a pretty unique approach in the whole state, isn't it? I mean,
right. Most clinics are shots only, in and out. And if you get a shot and it doesn't work, that's just too bad. And I'm not saying that's the wrong way to do it. That's just not the way we do it.
And when you're talking about these shots, what are you injecting?
Local anesthetic and steroid mostly,
Okay.
but we're talking about epidurals and other blocks that anesthetize people, and then we apply to that after we've done that and we've diagnosed the problem and we see that it's successful. Then we try to apply our longest available therapy to you, so you don't have to see us as often as you used to.
What are you most excited about that's happening in this field right now?
Oh, wow. That's difficult to say because there's so many new things. For
No,
example,
you can say more than one.
well, I really think that this interventional spine stuff is going to be huge because of the fact that so many people have chronic back pain, and not all of that is amenable to surgery. And so, rather than using opioids, which now are very, very late treatments, they're not at all first-line treatments, we may have other things that will buy you time or give you reasonable long-term relief that you can live a normal life.
Wow. Okay. So before we go, I always like to ask, what's the most important thing you want people that are watching or listening to this podcast, what's the most important thing you want them to know about pain awareness and chronic pain management?
I think the most important thing is not to suffer in silence anymore, and to ask someone or ask us, can anything be done for me? And you'll be surprised now that the answer most often will be, yeah, there probably is something. And so, many people think that they're relegated to suffering. They're not. And even if we can't do something for you, we can help you in those other areas, such as how to live with your pain, improving your range of motion, all things like that. So, let us know, and we'll answer you as best we can.
All right. Well, thank you so much for sharing all this information, and sounds like there's some exciting things on the horizon too to look forward to. So we're heading in the right direction, I guess. Huh?
I think we are, and thanks again for having me.
All right, great. Well, that brings us to the end of this edition of Live Healthy West Virginia. If you're looking for more information about chronic pain and its treatment, visit wvumedicine.org/pain. And to find the latest episode and all episodes of Live Healthy West Virginia, visit wvmetronews.com/podcast or the Metro News TV app. I'm Mary Ravazio Menard, and on behalf of Dr. Vaglienti and everyone at WVU Medicine, thanks for joining us.